Assalamualaikum Bu Risali.
Waalaikumsalam Bu Nia.
Sehat Bu?
Sehat? Alhamdulillah. Bu Nia
Alhamdulillah.
sehat?
Alhamdulillah. Nanti kita
Gimana
sampai
nih?
jam berapa Bu ini? Jam berapa sih? Jam 4.
Cuma 1,5
Jam
jam ya?
6 ya? Berapa sih Bu? Satu setengah ya Bu? Apa 1
Iya,
jam?
satu
Satu
setengah.
setengah. Oh, 1,5.
Iya.
Sampai jam 6 berarti. 6 tank.
Ya, kadang kurang dikit.
Oh ya udah kan biar gak untuk maghrib-maghrib banget ya. Tadi kayaknya ada mahasiswa yang hadir. Belum
Oh,
ya?
kabur lagi.
Ini recording ya? Boleh di
Iya, iya, iya.
pause
Iya,
dulu
Bu.
kali ya?
Iya, iya, Bu.
Tapi hostnya nggak ada. Hai, welcome, Nirjala. Halo. Halo. Hmm. Hmm. Hello, welcome everyone. I think we should have more students to come.
Yes, I think we should drop message in WhatsApp group once again.
Okay.
Kecuali tutayam, yom. Kecuali tutayam, yom. Nhạc lên. Nó còn một ini di kwa ve kwa ve kwa yang dia ali ni kwa mi amo ali ni kwa mi amo ke ya di
All right, we will wait for three more minutes. Then we will begin the class, okay?
Okay, ma'am.
Okay, I think we already wait for 3 minutes. Should we start right now? Ready, everyone? Hello?
Hello.
Hello, yeah. I think my voice is clear or not?
Yes, it is.
Yes,
Clear.
clear?
Yes,
Okay. Okay, Bu Sally, should we start?
Bu Rasamur, okay.
Okay. Uh, okay, good afternoon, all students. Please introduce myself. I'm Rosa Murchayan Forestrania, but you can simply call me Nia. So, you know, my last name, the last 3 letters, Nia. So I am Miss Nia, and here I'm with Miss Riseli. We are also the faculty member in Faculty of Pharmacy. We are part of the team teaching for the phytomedicine class. For today, we will discuss the material about the medicinal plants for anti-diabetic properties. So I guess group 4 is already here.
Yeah, very.
Yes,
Yes.
yes, great. So are you ready to present your work?
Yeah,
Wow, great. Okay, so please present your work, and after that we will have a fun discussion.
sure. Let me.
Yeah, I think you can share screen, right? Share your slide. Okay. So please everyone pay attention. If you have question, we will discuss after presentation. So please, the group 4.
Is it Sarah? Hello?
Hello? Yes.
Yeah.
Yes, it is.
Is it visible to everyone?
Yes, yes. Yeah.
Yeah. So, hello everyone. It's me, Sunil Joshi, along with my teammate Miss Kim, will present on diabetic mellitus. So, sorry. So without delaying any more time, let's start about diabetic mellitus. Uh, it is from the definition, it is a syndrome that is characterized by hyperglycemia. Cause
Sorry, Miss Sundal, would you please slideshow your presentation?
sorry, it cannot
Would you
be
please,
visible to
yeah,
everyone.
slideshow?
Oh,
You
sorry.
know, yeah,
Oh,
slideshow.
okay, okay.
To click the slideshow, yes.
Yeah,
Yes, yeah, perfect. Yeah, yeah. Please go ahead.
okay. Uh, let's start from definitions. It is a syndrome that is characterized by the hyperglycemia caused by absolute or the relative lack of the insulins. It is the disease which is caused by the resistance of the insulins or the deficiency of the insulin in the body, and and the Metabolism, insulin is important to metabolism of the carbohydrate, fat, and proteins, and so it if the insulin is deficient in the persons, it may affect in the metabolism of carbohydrate, fat, and the proteins. So associated with the dysfunctions of the multiple organs symptoms systems, including the kidney, eye, nerves, heart, and the blood vessels. To the persons who are affected by the diabetic mellitus, or the who are diagnosed with the diabetic mellitus, have the blood glucose level that fall that is above the 100 mg per ds, or to the persons whose blood glucose is normal, it indicated by the 60 to 100 mg per ds. Now the it is also defined by the enhanced peripheral glucose after uptakes, and it inhibit the breakdowns of the liver glycogens, enhance the storage of the glucose as glycogens, increase the protein synthesis, and increase triglyceride storage. Triglyceride is the product which inhibit the insulins in our body. So its increase in the body will cause the diabetes. So here is the classification of the diabetes. That is type 1 diabetes, which is commonly known as insulin dependent, and the type 2 diabetes is known as the non-insulin dependent, and the gestational diabetes, secondary diabetes, that is associated with the certain conditions, and the diabetes which is caused by malnutrition. So in type 1 diabetes, there is a destruction of the beta cells, which are essential for the productions of insulin. So absolute insulin deficiency is caused by the destruction of the beta cell. And in type 2 diabetes, the insulin resistance with insulin secretion deficiency, about 90 to 95% of the people have the diabetes, have type 2 diabetes, who have the type 2 diabetes. And the third one is the environmental or the certain factor that cause the diabetes, that are the beta cells function deficient in the beta cells functions, genetic defect in the insulin actions, exocrine pancreas disease, and the endocrinopathies, drug or chemical induced infections, and other rare forms. And the last one is the gestational insulin resistance with the beta cells deficiency dysfunction now. And let's move on the pathophysiology of the disease. So in pathophysiology of the disease, the biphasic insulin release in our body is totally daily secretion of the insulin is 40 units, and the basal stimulation rate is about 1 unit per hour. And if it increase in the in the persons who take meals about 4 to 5 fold. And the deficiency of insulin cause hepatic glycogenolysis, and the glucose genesis increase the hepatic glucose output, and the decreased glucose uptake in the insulin sensitive tissues increase in the blood glucose levels, which may cause the diabetes. And the cell start metabolizing after increased ketone body. Ketone body is means the acid form after acid form in the glucose after the absolute deficiency in the insulins. So cell start metabolizing fat, and it is mainly ketoacidosis is mainly in the insulin dependent diabetes mellitus, and the non-keto hyperosmolar coma is in the insulin non-insulin dependent diabetic mellitus. And sorry for that, ketoacidosis is mainly occur in the patients who are in insulin dependent diabetic mellitus. Next symptoms, the patients who have the diabetes mellitus have the symptoms of polyuria, polydysplasia, weight loss, lethargy, tiredness, and blurred visions, boil or abscesses, diabetic ketoacidosis, retinopathy, nephropathy, neuropathy, and the food ulcers. And the last one is angina, myocardial infarctions, etc. The diagnosis of the diabetes is by the polydysplasia, polyuria, polyphagia, and fatigue, weight loss. The persons who feel are weightless may cause diabetes. And the abnormal hearing, if the persons have the wound and they are not ill on the times, it indicate to the maybe it indicate to the persons who are affected by diabetic mellitus, increased occurrence of the infections. That's it. And the risk factor for the asymptomatic patients, it is a strong to the persons who have the strong family history, obesity, women with the previous GDMs, and the hypertension, hypertriglyceridemia, and the 40-year-old with any of these above symptoms. And the treatment of the treatment to the patients who have diabetic mellitus, this is the allopathic treatment, and in this treatment there is a dietary therapy which may be reduce the taking of glucose to the patients who have the diabetes. And insulin therapy is mainly for the type 1 diabetes patients. And sulfonylurea, vegonides, alpha glucosidase inhibitors, these are the medications that are used in the used to the patients who have suffered with the diabetes. And let's move on the topic, that is the Indonesian plant with the potential anti-diabetic properties. There is a that its overview is that the traditional Indonesian medicines known as jamu pahitans is a bitter herbal formulations traditionally used for the managing diabetes, and the main components that are found in this in these formulations, that is jamufathrin, that are andrographic paniculata, that is a king, that is also known as the king of bitters, which is an herbaceous plant known as to be bitter taste, and widely used in the traditional medicines for its immune boosting and anti-inflammatory properties. And the active compounds is grapholides is a key active ingredient found that in the andrographic paniculata. And next one is a Tinospora kypsa. It is a vine native to the Indonesia, known for its medicinal property that is commonly used for the treatment of the fever that is associated with the diabetes, and as a general tonic. And the active component that is found in this plant is tinosporin and other alkaloids. So next one is the curcuma longa, that is known as commonly known as turmeric, and it is a rhizomatous herbaceous perennial plant, and it is mainly used for the anti-inflammatory and antioxidant property, and the curcumin is the primary active component found in this plant. The moving on the mechanism actions of the jamufathrin phaeton, that is for the endogenic graphies paniculata. It is mainly used for the glucose uptake, that is andrographolides enhance the uptake of the glucose into the cell, aiding in bitter glucose blood sugar control, and the insulin secretion. It also help to the patients to increase in secretions of the pancreas secretion of the insulin in the from the pancreas of beta cells, improving overall glucose metabolism. And next one is the Tinospora crispsa, which is it acts as a mimetic to the insulins and help to absorb the glucose in a body. Also help to produce the beta cells. And next one is the curcuma longa, which is known as an anti-inflammatory. Curcumin reduces the inflammations by inhibiting the NF-κB molecules that play a significant role in the chronic inflammations in the pancreatic cell. Antioxidant, curcumin neutralizes the free radicals and stimulates the body's own antioxidant enzymes. And next one is the insulin sensitization. It also helps in the it also work by help in the insulin sensitizations. Next one is these are the medicines which help to the reduce the glucose level in the body. That is Cytolus colonscientis, that is known as a bitter apple or a cucumbers, known for its therapeutic qualities, especially in the Indonesia. This plant contains the significant amounts of the galacturonic acids and the colosanthins derivatives. These the seeds are rich in the albuminoids or the fixed oils, while the cucurbitacins and the flavonoids are primarily concerned with the therapeutic role, and that is used basically used in the diabetes. And the next one is a Funica granatum. It's known as a pomegranate, and it is used as a traditionally as a Ayurvedic medicines which contains several significant active chemical constituents like the cholerganin, elegans acid, and
Hello, we cannot hear your voice.
hello.
Yeah, hello. Yeah, I can hear you now.
Yeah.
Yeah.
Okay. And talking about the Funica granatum, the recent research indicate that the valonic acid dilactone is a major compound contributing in the anti-diabetic activity. Next one is allicin. Allicins, that is an active ingredient extracted from the garlic, which help to improve the fat accumulations, body weight, and blood glucose levels, and prevent age. That is age means the advanced glycations in product development in the rat by inhibiting the race, and thus reducing the oxidative stress and increasing the insulin secretions. Next one is a cinnamon compound, that is Cinnamomum acacias. This plant in regulating and stabilizing the glucose levels in type 2 diabetes patients. The polyphenols present in the cinnamon, particularly polyphenol A, may play the role in the lowering the blood glucose levels. That's all about my parts. Next I will invite Miss Kim for the presentations. Thank you.
Yes, okay, thank you. My name is Kim Ngân. I'm from Vietnam. You can meet it Kim. Then this is some picture about medicine plant. And on the left picture, you can see this is endoraphic, paniculata, With on the right picture, you can see this is curcuma longa. Next, hello, can you hear me?
Yes, I can hear you. Please go ahead.
Hey, Sunny, please next slide. Hello,
Hello.
you?
Mr. Sunil, next
Uh,
slide.
Yeah, next slide.
Next slide.
oh,
Okay, on the left picture, this is Tinospora spicera, and on the right picture, this is Citrus solosynthid. With this plant, it is like watermelon. And next slide, okay. With on the left picture, this is Bunica ranatum, and on the right picture, this is Cinnamomum cassia. With preparation, some researchers report that andrographid panicula, they often yield ethanolist extract. With citrus colosynthid, they often yield aqueous and alcoholist extract. With curcuma longa, some reporters report that aqueous extract of turmeric combined with cinnamomum cassia, they offer in powder. From the powder, they often extract with water. With Tinobora spicera, some researchers use aqueous extract. With Bonica ranatum, some reporters use aqueous extract. And on lysine, this is unactive anhydride extract from garlic. And door of dosage from the andrographis paniculata, some researchers they have a research about which frost the optimum dosage from the andrographis paniculata.
Mr. Tony, would you please audio? Mr. Tony, would you please turn off your audio? Hello, Mr. Tony Omara. Hello. Okay, I think it's good now. So please continue, Miss Kim.
Yes, okay, thank you. With price, some researchers research the optimum dosage from ethanolist extract of this plant were 434.6 milligrams per kilogram of body weight. With curcuma longa, research has shown the neuroprotective action of aqueous extract of turmeric combined with metformin, and for that curcuma display the accuracy of diabetes into neurodegenerative complication. With Tinospora rispa, draw endorsed from in the 95% ethanolist extract of this plant out at the 250 and 500 milligrams per kilogram of body weight, improve overall glucose tolerance in normal glycemic blood, and they have 2-week treatment with the extract improve the glucose tolerance of the animal. Acute intravenous administration of the extract is about 50 milligrams per kilogram. With citrus colosynthid, oral administration of the aqueous extract of this plant can mitigate some of the toxic effects of tetrodotoxin. Next plant, this is Punica ranatum. Some reporters report that oral administration of Punica ranatum with accurate extract at dose of 250 milligram per kilogram and 500 milligram per kilogram for 21 days result in the significant reduction in fasting blood glucose. The last three, this is cinnamomum cassia. A patient interested in using cinnamomum for treatment of diabetes could use a starting dose of 1 gram daily and increase, but should not exceed 6 grams of cinnamon per day. Cinnamomum cassia is available in a capsule from. This is some article we use for our presentation. And because I couldn't find some product from Indonesia, I think this is relevant network from my country. So I have some product from Vietnam. Some doctor often use it for their patient. On the left picture, this is blood sugar control from Australia. And the middle picture, this is measuring gun from Japan. And the last picture, this is product of Vietnam. So I want to introduce with you some plant in Vietnam is used to treat diabetes mellitus. It's good inhibits enzyme alpha-glucosidase. On the left picture, this is Philanthus orinata. This plant, the root tree, introduced in last week. Moreover, when mother dog have a stomatic after giving birth, they often find and eat it to relieve pain. On the right picture, this is Mellitus marabilis. Can be found in many flights of Vietnam. And the other tree I want to introduce with you, this is Animals Flaciforus and Barania timora. Because I am a final student and my radiation hosted this investigation of chemical composition and potential biology about this tree. But this is extend thyroid oil from the leaf of Paratimora. So this is some references we use to our presentation and for listening. Thank you.
Okay, thank you very much, Ms. Kim and Mr. Junil for very interesting and informative presentations. Please give applause to the group 4. Thank you very much.
Thank you.
Okay. Anyone will ask questions, or maybe Buseli want to add some informations, or we can start the discussions together.
Maybe we start discussion before.
Okay. Before I start the discussion, maybe anyone here have questions that we should address before continue further? No one? Okay. So we will start this discussion, okay? So group 4 already presents very interesting informations about plants in Indonesia and then also in Vietnam, and also about the background of diabetes mellitus. And we already recall our memory that diabetes mellitus, it has 4 types. Types 1, types 2, and then just the gestational diabetes and other types of diabetes. So I have one question that we should discuss together. We know that plants have activity and diabetes, but what kind of diabetes? Meaning that if we have family or friends that has type of certain diabetes, should we recommend medicinal plants or not? Anyone have idea? which type of diabetes for these medicinal plants?
They are especially for the type 2 diabetes. These plant are made. These plant extractions are made for the type 2 diabetes patients.
Type 2.
Yeah.
Yes, yes, absolutely correct. So why not type 1 diabetes? Yeah, first, anyone? Yeah, please, Mr. Sunil.
Many people have the in type 2 diabetes, they have the deficiency or the they are
Type 1 diabetes because there is
a insulin deficiency in these
yes,
peoples, and
right.
they cannot produce insulin by themselves, so they need
Mhm.
to insulin therapy. So in type 2 diabetes, they have the insulin resistance that can be improved by the medications or the some medicines. That's why they are used in type 2 diabetes.
Yes, yeah, it's correct. Yeah, it's completely correct. So because type 1 diabetes is because of the autoimmune, yeah, that's why it's depend on insulins. Yeah, that's why mostly type of diabetes that need to have like medicines, other medicine is type 2 diabetes. But there's also some research that they use a animal model of type 1 diabetes. But if you try to search the literature about type 1 diabetes and then medicinal plants, the human testing or randomized clinical for human is very lacking, meaning that the medicinal plants for type 1 diabetes is still not conclusive yet, meaning still need to be more research to be conducted for type 1 diabetes. It is possible, but still need to have more research for the type 1 diabetes. All right, and then we will go over the plants. And basically, Mr. Sunil and then Miss Kim already explained some of the Indonesian plants. And I'm also surprised that also learn Bahasa. You know, Bahasa is Indonesian language, you know. I think you mentioned about jamu pahitan. Do you know what is it mean?
Yeah, I saw in internet. That is
Yes.
the soup or something like that. That is made by composition of 3 plant that I mentioned in the presentations.
Yes. What plants? What the Latin name of the plants for the jamu pahitan? Anyone remember or maybe open the presentation? What the jamu pahitan means? So jamu, you know, jamu is our traditional medicine, and pahitan mean bitter. So what's the constituent of jamu pahitan? It must taste bitter because pahitan mean it tastes bitter.
Constituents are Andrographis paniculata. That is for the bitter taste. And next one is a Tinospora crispa, and that is used for the treatment of fevers that is associated with the diabetes. And for the tonic, and the next one is the curcuma, which have the anti-inflammatory and the antioxidant properties. That's it.
Okay, thank you very much. So why it is called as jamu pahitan? You know, jamu meaning our traditional medicine, pahitan mean it tastes bitter because it tastes bitter. So actually one of the plant that tastes bitter is Tinospora crispa. Tinospora crispa, yeah. So anyone knows about Tinospora crispa? Maybe in your country it has Tinospora crispa as well. What do you call it in your country? Tinospora crispa. Anyone have the Tinospora crispa in your country or not? Hello?
Yes, it is found in our country. It's called as a gurjo. It's
Oh,
common name.
Gurzo.
Yeah,
It's common.
yeah,
Yes.
in our country.
Okay. Okay. So I think we have one question. How the diabetes can cause weight loss? Yeah. It's typical too. Anyone can guess? The weight loss, is it in diabetic type 1 or type 2? Anyone still remember? Yes, it is right that one type of diabetes can make people, yes, right, type 1 diabetes, right. Okay, anyone can explain why? Do you take the pharmacology class in this program or not? No? Not taking the pharmacology class? Yeah, I think it better to be explained in pharmacology class about how to understand the mechanism of the diabetic type 1, how the autoimmune of the beta cell of the pancreas is deficiency, meaning it's not able to produce the insulins, and because of the it has genetic factor. It's commonly in a very young age. It can develop at very young age compared to type 2 diabetes. So there is a certain mechanism that's why the type 1 diabetes, some of them is not, have a weight gain, something like that. But type 2 diabetes, because it also correlates with the lifestyle, like high intake of the high glucose food, something like that, and also another disease. Yeah, it can make also correlate with the obesity. It may cause the weight gain. So I think it will be better to be explained in pharmacology class. Okay. Okay. Thank you. And then, yeah, thank you for answering the question, Claire. Okay. So we will continue to discuss about the Tinospora crispa. Okay. So in Indonesia, we call it as the brotowali because it has bitter taste as well. And do you notice in what part of the plant it is used for the diabetics? Is it from the leaves? Is it from the roots? Or from the fruits? Or from the stem?
Steams of the Tinospora crispa are used. Maybe steam.
Yes, correct. It's from the stems. And then, yeah, the stem, it has a very unique characteristic. Yeah. Have you ever seen the stem of Tinospora crispa?
Yes, I have.
Yeah. Anyone here ever seen the stem of Tinospora crispa? No one? Not yet. Okay, let's let me show you the stem of Tinospora crispa. Okay. Please wait. My device is still loading. So this is the stem of Tinospora crispa. This is the leaf, and this one is the stem of Tinospora crispa. Okay, and then we will go to the next question, maybe still about the Tinospora crispa. If we learn about the phytomedicines, we also learn about not only the pharmacological effect, but also is there any side effect of the use for the medicinal plants? Anyone can answer? Is it correct if someone tell you that all of the medicinal plants is safe? Meaning, if your relatives or your friends ask you for medicines come from herbal, so and then they say that I want to consume this because it's safe in comparison with the conventional medicine. So is it true or false?
Basically, Tinospora crispa can cause nausea, vomiting.
Yes.
Yeah.
Yeah, it has side effect.
Yeah.
Yeah, right. It has side effect. And what else? Is there any other thing that we should pay attention on consuming the medicine? Like for this one is Tinospora crispa. Other than side effects, what's the other things? Please don't hesitate to open your microphone. I think there are a lot of in the chat box, a lot of text in the chat box. It's okay to speak out, Miss Ella. Toxicity, I think, in terms of dosage too high. Yes, it can be, right. If we talk about medicine, any medicine, whether it is conventional medicine or from medicinal plants, if it is medicines, meaning that it has dosage. The dosage need to be approved by and provided based on the scientific evidence. Now, because the medicinal plants have not been tested and no clinical trials. Okay, so this is going to be a very good discussion. So it's okay to open your mic. Don't be shy. Okay, we just have fun discussion. So feel free to ask question, to answer, and everyone is free to open the mic. But if you are comfortable with the chat, it's also okay. I will try to open my chat. Okay, so we will discuss about this one because the medicinal plant have not been tested and no clinical trial. That's why it might potentially have a bad effect or other side effect. But the thing is that in Indonesia, actually the product of medicinal plants, we have 3 types. One of them is jamu, and we have the other ones. Anyone here remember the name? Jamu is the first and then the lowest level of Indonesian medicinal plants. And not only plants, but we also have another type of the natural products that we use also as the medicinal, natural medicines. jamu and standardized herbal medicines. Have you ever heard this term before? Standardized herbal medicine? No one hear about this? If anyone heard about this, please raise your hand. Standardized herbal medicine. Oh, really? No one heard about this one? The other Indonesian plant, yes. Anyone heard about standardized herbal medicines? We have jamu. Jamu is the medicinal plants or natural medicines in Indonesia that we use. Not sure, but yeah. So let me explain. Maybe I will give you a picture. Let me open my slide, okay? But because this is in Indonesia, because this the three categories is divided by our regulatory officer, our Indonesian FDA. So this one is in Bahasa, but I will try to explain it in English. Let me show you, okay? But let me open my slide first. So there is certain symbol that if you see this symbol, it must be the products, the natural medicinal products from Indonesia. So wait, I opened the wrong one. Okay, I think this one. So be patient. I almost there. There are three categories. First is jamu, and second is standardized herbal medicine, and third is phytopharmaca. So yeah, this is the one. So I will share my screen again. Okay, anyone can see my screen? Yeah, everyone can see my screen?
Yes, it is visible.
Yes. So I'm sorry, this is still in Bahasa, but because of this is the product in Indonesia, the label will be also in Bahasa. So the first one, it has the symbol of, leaves, okay? And we call it as jamu. Jamu is the lowest level of Indonesian natural medicinal products. Why the lowest? Because it is become the products based on the empirical studies, meaning it because of the traditional usage, from generation to generation, minimum 3 generations. So your great grandfather already used that medicinal plants, and then our agency, Indonesian FDA, will review all the documents based on the traditional usage on these 3 generations. After they approve that the usage is true, then it will be the jamu. But please don't confuse that we have also other types of jamu. But this type of jamu that has this symbol, the leaf symbol, it's approved by our Indonesian FDA. It's regulated by Indonesian FDA. But we can also prepare our own jamu by self-preparations. Like you are doing infusion, decoctions, or we also have, we call it as jamu gendong. Yeah. So the person, yeah, mostly they are women. They will gendong is Indonesian as a holding your jamu on your back, something like that. So, but that one is not approved by or not regulated by FDA because it's considered as the self-preparation. But for the jamu, it is produced by certain of, it's not industry, but it's already almost like industry, but it's already like controlled by our Indonesian FDA, so that it become like a product. But from other jamu like self-preparation decoctions, infusions, it is not. It doesn't have to. You doesn't have to register to Indonesian FDA to get the number to become this kind of jamu. And then the second, we also have this Indonesian standardized herbal medicine. It has like snowflakes, something like this, three snowflakes in here, and it has one level higher than jamu. We call it standardized herbal medicine. So terstandar means standardized, herbal is herbal, obat mean medicine. Yeah, why it's better than, not better, but higher level than jamu, because it already approved by Indonesian FDA based on the preclinical trial. So it already tested preclinically toxicity and the pharmacodynamic, also the efficacy. So if jamu before, because of the traditional usage, the obat herbal terstandar or standardized herbal medicine has preclinical studies. And the raw material and the final product has been standardized. So it has higher level. And then it already produced by the kind of industry that already applied GMP, good manufacturing process. And then the higher level than the standardized herbal medicine, we have a product called phytopharmaca that has the symbol of this one. What is this? Snowflakes, one snowflake, but only one snowflake. This is the highest level. Why? Anyone can guess? Anyone can guess why the phytopharmaca is the highest level? Anyone? No idea? Okay, because it has preclinical study plus clinical study as well. So, yeah, it's almost the same as regular or conventional drug because it's already approved and it has already the clinical proof about the efficacy and then the safety data. Yeah. So what's the good thing about the phytopharmaca is that in here, the herbal doctor can prescribe medicines only for the phytopharmaca products, but they cannot prescribe the jamu or standardized herbal medicines. And it also already produced by industry that already apply GMP, and the raw material and the final product is also already standardized. So that's about Indonesian type of natural medicines. And maybe you are confused why I say before that it is not only a plant. Yes, it is not only a plant, but in here you are taking phytomedicine. Phyto meaning? Anyone know phyto? What's phyto mean? Anyone know phyto? Phytomedicine. What phytomedicine mean? Medicine is, yeah, you know medicine. What phyto mean?
Plant-related medicines, or
yes, plant-related medicine. But in Indonesia, we also have animal as part of raw material. Yeah. So, but we will not studied in this class. Maybe in another class. Okay, maybe next summer course maybe. Okay, we will back to the question. I hope it will add the information about Indonesian plants. Yes, plant is phyto, right? So yeah, I think I was discussing about the other than side effects. What is the thing that we need to pay attention is the interaction. Is there any interaction between herbal and anything? Do you think? Is there any possible interaction if we talk about medicines or conventional medicine? Yes, it can be interaction. But how about herbal? Is there any possible interaction? Let's say the Tinospora crispa. Is there any interaction reported? So if we want to consume the herbal, we also need to pay attention. Is there interact with another drug or interact with food? Yeah. Yes. Yeah, there is interaction. Yeah. The interaction from the Tinospora crispa, it might interact with medication that affect the liver. Okay. Okay. I think that's the summary for the Tinospora crispa or the Brotowali. And then I also interested on the almost the last slide. Yes, right. Almost the last slide, Miss Kim also share one of the plant in Vietnam. But that plant in Vietnam is also that plant in here, and we also consume it as a regular food. We call in here as pare. So the Latin name is Momordica carantia. Anyone know about Momordica carantia? What is this? What's the English name? Momordica carantia. In here we call it as pare. Maybe I will show you the picture, and then maybe you will notice what kind of plant is this. Okay. Okay. Let me know if you familiar with this plant or not. If anyone familiar with this plant showing in your monitor, please raise your hand. Think there is a chat. Yes, Mr. Sunil. Oh, Miss Ella haven't seen it at all. Okay. From Nigeria. Okay. Anyone know? How about Miss Kim? Miss Kim? Yes.
Yes, I'm here. Vietnam also have it, and we also use it for soup to eat with rice.
Yes, yes. So Indonesian and Vietnam, I think we have the same type. So anyone again, maybe use this kind of, we call it in English, we call it as bitter melon. Bitter melon. No one? Okay. Again, the name is bitter melon, meaning it tastes what, Miss Kim? How it is? Is it taste? What?
This bitter.
Yes, it's bitter. Yeah, but we still consume it as a food. Okay, and it is interesting that in Vietnam, it is also one of the ingredients, and also from Japan, it is the ingredients for medicinal plants for anti-diabetes. This is the same in Indonesia as well. We also use bitter melon as the one of anti-diabetic agent. And then may I ask, you already see the fruits, okay, and it also has actually a plants. So what is the plant part or simplicia that used for the diabetics? Maybe Miss Kim knows, or Mr. Sunil know which part of the plant which used for anti-diabetic properties. Is it from the leaves, stem, fruits, or roots?
I
Oh,
think
ini
it's
Pak.
from fruit.
From?
Fruits.
From fruits, yes, from fruits. So it absolutely tastes bitter. Yeah. So in Indonesia, we usually crush the fruits and then squeeze and then drink it. So it's very, very not pleasant taste. But because it has a very good effect, we still consume it. For some people, not all. Okay, so from the bitter melon, is there anything that we need to pay attention?
Yeah, it may cause hypotension.
Yes, of course, it will cause hypertension. Is there any other warning, interactions, or contraindications? If we talk about the medicines,
It should not cause. It should not take by the patient who are who are taking their medication, hypertensive medications.
okay. Anyone else want to add information? Who Miss Miss Nirjala Koju, you like this vegetable? Maybe you can share the experience for your country. Is there any caution, warning, or contraindication that you might add the informations about the bitter melon?
The only warning that I know is that you should not consume it if you have really low blood pressure. That's it.
Okay, okay, thank you so much. Yeah, it's very informative. And then the thing is that it has actually a warning for pregnancy and breastfeeding, also for children. And it actually also have cautions for all part of the plants. It might also affect the fertility for both men and women, particularly if you consume it too much. So because it is food and then it also tastes bitter, yeah, some people don't consume it too much. But if you really like it and you consume it too much, please be cautious that it might also affect the fertility of male or female. Okay. And then, yeah, it also has interactions. Of course, if it's combined with other anti-diabetic drug, it will produce and it will enhance the anti-diabetic effect. So like hypoglycemic effect. Okay, so that's for the other Indonesian plants. Okay, so I think one of you also mentioned about Andrographis paniculata, ya, Andrographis paniculata. So we call this plant in Indonesia as sambiloto. Okay, so first I would like to ask is what part of this plant used for the anti-diabetic properties? Is it leaves? Is it stem? Or what parts? Anyone else? I think we will have around 10 more minutes. We don't have much time. Okay. Anyone knows about this plant Andrographis paniculata? In the plant parts in where the activity came from? We call it as Simplicia. In what Simplicia? Have you ever seen the plant? Not yet? I think not yet. Anyone will answer? No. Okay. Anyone will guess in what part in what plant part we usually use it as anti-diabetic?
I think it is from leaf.
Yes, it's true, but still 50%. Do you know why?
No.
Yeah, because actually we use the herb. So every plant part except the radix. You know the radix, the roots. So every plant part, including the leaves, the stems, we use it. Yeah. So again, if we talk about the plants, there will be contraindication, warning, and also side effects. And for this one, the Andrographis paniculata, it also contraindicated from pregnant women and breastfeeding women. Okay. And yeah, also I haven't mentioned it before. There's also one thing that we need to pay attention if we consume herbal medicine. What is this? Hypersensitivity, right? So if you hypersensitive to any herbal medicines, what should we do? If you develop hypersensitivity when you consume any medicinal plants, what should we do? Yes, we need to stop them. Okay, yeah, right. We need to discontinue them. Okay. I think we already have the same view. So yeah, the Andrographis paniculata, it has one compound that is very well known, and then it also mentions before. What is it? Andrographolite. Yeah, andrographolite. So do you know andrographolite is what type of what chemical? It is alkaloid, right or wrong? Have you heard the name of plants chemical like alkaloid, saponin, what else? Flavonoid, tannin. Not yet? Okay, we actually have phytochemical class. Yes, right. This is terpenoid. Yeah, terpenoid. Yeah, okay. This is terpenoid, and it is diterpen. Okay. And then the andrographolite is the bioactive compound, and also here it used as biomarker, meaning that if we want to know the quality of the plants, we will use these compounds to see. So in here we have Indonesian monograph that the good herbal quality should have minimum certain quantity of certain chemical, something like that. So we use the plant chemical as the marker or biomarker to see the quality of the plant material that we use for the products. And I think I have one thing to discuss, and it is maybe interesting for you. It's about the cinnamon. Yeah, we call it Cinnamomum burmani. So I will ask question. In here, is there anyone who doesn't know about cinnamon or never taste cinnamon? Cinnamomum burmani. Or everyone already know about cinnamon? Who is the one who knows the cinnamon? You may raise your hand. Cinnamon. Hello? Do you know what cinnamon is? Cinnamomum burmani. Yes, cinnamon. Yeah, cinnamon bark. Right. Yeah. Anyone in here do not know about cinnamon? Everyone knows. Everyone knows? You sure? Okay. Yeah, yes, a bit. Okay, thank you, Miss Nirjala. Actually, I know cinnamon we use it for popcorns of coffee. Okay, that's great. Okay, actually we have different types of cinnamon. In Indonesia, we have cinnamomum burmani, but in another country, it might have another type of cinnamon. So may I ask you, the type of cinnamon in your home country is easily to break or not? It is very hard to break or it's easily to break? And then the color is might be lighter than. Okay, I will share you Indonesian cinnamon. You might notice that it might have slight differences. Okay, is this cinnamon in your country is like this, or it has difference? Because there is also another cinnamon.
No, it is not very coiled in our country. It
It's
is
not
a
like
bit
this?
flat and no, it is
Uh,
like this.
Okay, is it easily to break, Miss Nirjala? Like easily to break?
Like it's quite easy. Yes, we can break it from hands.
Okay, yeah, that's great. So that's the thing that I want to address. Yeah, we have different species of cinnamon. In Indonesia, we have Cinnamomum burmani. So the bark is like this. It is very hard bark. So we cannot break it easily. So it also formed like this. Yeah. And the other one, Cinnamomum verum. You might type Cinnamomum verum. How is the cinnamon or the bark look like? Yeah. In Indonesia, we use this Cinnamomum burmani because we have this kind of plants and we easily can collect this plant. But from Cinnamomum verum, we don't have it. Yeah. And basically, the Cinnamomum verum has a higher price than the Cinnamomum burmani. Yeah, and it has slightly different chemical constituent, including the coumarin constituents. Yeah, but both Cinnamomum verum and Cinnamomum burmani, it also used for anti-diabetic. But in Indonesia, mostly we do study in Cinnamomum burmani, so it also used as anti-diabetic. Yeah. Okay. So that's about cinnamon. Maybe Bu Sally want to add some information?
Maybe in a home, Miss Nia, and the time is to break up the class.
Oh, okay. So it's done?
Yes.
Okay. Okay, thank you so much, Miss Riseli, for reminder. Okay, I think because the time is up, before we close the class, is anyone want to ask questions? Or we can close the class? No one? Okay, I think we should stop the class. Thank you very much for all students who came and share the information, and then we learn together, and hopefully this topic here we learn together will be beneficial for all of you. Thank you so much. See you in the next class. I think for me, I will have several weeks until you see me again. Okay, thank you, and good night maybe ya, because in here it's already night. Bye.
Bye-bye.
Bye. Terima kasih. Sampai jumpa.
Kasih Bu Nia.
Ya, sama-sama Bu Sally. Izin live.
Izin leave.